Welcome to the Natural Health Podcast, where we bring awareness of sustainable health in the business hustle space. The Natural Health Podcast is perfect for the high-performing, business-minded individuals who want to work with the biochemistry to achieve optimal health. Let's get into today's podcast. I've got a question for you, and the question is do you suffer from either diarrhea or constipation? Or you have a mixture of them where one day you're constipated, the other day you have diarrhea. Either way, if you do suffer from constipation and diarrhea, I know how hard that is and how hard that can impact your life, your every day. That is exactly why I wanted to look into today's podcast. Today I'm going to be talking about irritable bowel syndrome. If you have been diagnosed with this, you probably do have either constipation, diarrhea, or mixture of it, right? So you've been diagnosed, but you don't really know what it is. You don't really know what to do. Well, that's what I'm here for. In today's podcast, we're going to go through what is irritable bowel syndrome. I'm going to go into what triggers it. How does it even happen? Why do you have it? Right? And then, of course, I'm going to go into 3 tips how to calm your IBS. Let's get into it. It's Mondays with Mihaela. That's right, me. Thank you so much for tuning in. I absolutely love, and appreciate your support. For any of you who don't know me, my name is Mihaela. I'm a qualified naturopath, and I'm here on Mondays to provide you with simple, savvy, and sustainable health hacks to optimize your health. And today's is Mondays with Mihaela, which is a segment of the Natural Health Podcast. If you want to follow it, subscribe, like, share the podcast, get that information out there. But today I'm so excited because you listening, you probably do have constipation, diarrhea, or you've gone to the doctors and they're like, well, we don't know what it is. Let's say it's irritable bowel syndrome, because you know what? That's what usually happens. People come to me and they've got gut issues, they've got digestion issues, they constipated, they've got diarrhea. We've gone to the doctor and they've said, okay, you've got IBS. And then that's it. And off they go home, and that's it. They keep eating the same food. They keep living the same lifestyle. They keep taking the same medication. Does it get better? No, it probably gets worse, which is how it started anyway, right? So the thing is I'm here to provide you today with information about what is irritable bowel syndrome. What is it? You might have got an explanation of a sentence on 2, but I'm here to give you about half an hour's worth of information. And if you stick to the end, I'm even going to give you tips on how you can actually calm your IBS, because I understand it could be so difficult living a life having IBS, because every day, everyone's walking around and you're like, where's the next toilet? You're on a lookout. You probably downloaded an app on your phone finding the next toilet, or you're so bloated and you have so much discomfort that sitting on the toilet just gives you trauma and nightmares, right? So that's what I'm going to here for, because once you understand what irritable bowel syndrome is, you'll feel a lot better. Not only will you feel a lot better, you actually know why you may have it and what you can do about it, right? So let's get into it, right? Irritable bowel syndrome, we'll call it IBS as short throughout the podcast, so we don't have to keep blabbing on, and we'll get to the bottom of it, right? It is a common debilitating condition which significantly affects the patient's quality of life, like I said, right? It comes with a cluster of gut symptoms. So many gut symptoms, right? But the key one being abdominal pain with either, like I said, constipation or diarrhea, or both. That is the key. So for someone to be, classified as they have IBS, you got to have constipation, diarrhea, or both, right? But little is spoken about the additional symptoms that individuals have, like flatulence, frequency and severity between individuals and the same individual at this point of time. So what it says there is kind of different. Your IBS is so different to, for example, if I had IBS, which I did have IBS. Well, and the thing is it's so different. Your IBS compared to my IBS might be so different, right? It kicks in at different times. It gets better at different times. It's worse at different times. So you can't really compare if, you've got someone next to you and you're like, hey, how's your IBS? And they talk about it, they're like, oh, that doesn't sound like mine, but it's the same, you've got the same, doctor said that you've got the same diagnosis, right? So it can be different, right? So the thing that we need to understand is that the key components of IBS pathology, which is the underlying cause of it, include, and this is what you may not have heard about, is an imbalance of microflora, which is called dysbiosis, which means you've got your good and your bad bacteria. You're supposed to have a balance that I always talk about, and it's just gone out of whack, right? So then, and there's also visceral hypersensitivity. There's also a link to food. There's also a link of intestinal epithelial barriers, right? Which I'll go into detail a bit later. You're going to find this so interesting. I found it so interesting, right? So due to IBS being so wide and like so different to every single individual, a holistic approach needs to be taken to it, which encompasses supplements, diet, lifestyle choices, and also digestive management strategies. So you can't just deal with it with one thing. It has to be a combination of things to talk to your healthcare professional and get it under control, right? Because when you get your IBS under control, you're going to be living a different life. You're like, where have you been all my life? I remember when, my IBS symptoms went away, which took a number of years, I was like, oh my gosh, this is amazing. Is this what life is about? I don't have to run around a toilet. I don't have to think about when I'm going to be going to the toilet next. I don't have to have trauma related to toilet. I can just go every day that I'm supposed to be going in the morning, and that's it. I don't have to think about when the next one's coming or if the next one is coming, right? What an amazing life, right? It's the little things in life, right? But let's look into, so there's different types of IBS, right? So there's IBS-C, which is constipated, right? Which means, you've got hard or lumpy stools, and it kind of says like that 25% are hard and lumpy, and loose or watery stools is less than 25%, right? And then you've got the IBS-D, which is diarrhea, which is more mainly loose or watery stools and less hard and lumpy. And then you've got IBS mixed, which is kind of a combination of both. So you kind of got constipation one day, diarrhea the next day, and so forth, right? And then there's also this thing called IBS-U, which is so interesting, right? It's called unsubtyped IBS. So it's kind of insufficient abnormality of stool consistency meeting either IBS-C, D, or M. It's kind of like if it doesn't fit in IBS-C, IBS-D, IBS-M, it is IBS-D, right? That's how we work here, right? It's quite interesting. So what we also need to understand is the fact that patients also complain about a variety of other symptoms such as bloating, increased flatulence, nausea, fatigue, and back pain. And you might be like, oh my gosh, yes, I have that. I have all of them, right? It comes with IBS. Fatigue is major, right? If you're running to the toilet all the time, of course you're going to be fatigued because you're removing so many mineral, vitamins, electrolytes out of your body. But at the same time, if you're constipated and you're keeping all the toxins inside of your body, of course you're going to be fatigued, right? So don't be like, I'm the only one that's fatigued and it's not normal. It is. If you have IBS, fatigue is absolutely normal. But the key is, what are you going to do about it, right? So you must have gone to your doctor if you have been diagnosed with irritable bowel syndrome, and they have maybe spoken to you about the Rome-3 criteria, which essentially is how IBS is diagnosed, right? It always presumes the absence of structural or biochemical explanation for the symptoms. So the Rome-3 criteria is based on the presence of recurrent abdominal pain or discomfort for at least 3 months, with symptoms on at least 3 days of a month, including at least 2 of the following symptoms. Irritable bowel is commonly diagnosed using the Rome-3 criteria, which always presumes the absence of structural and biochemical. So essentially what this is saying is you have irritable bowel syndrome if you have at least 3 months duration of having either constipation, diarrhea mixed, but it has to occur at least 3 days a month, right? Including, so the interesting thing about this is, right, all my women out there, right, 3 days a week, right, that's part of your cycle. How many individuals do get either constipation or diarrhea around their cycle, right? Interesting. So the criteria has its downsides, and it's got a little bit of downsides, but essentially this includes the Rome 3 criteria. The signs and symptoms of IBS are abnormal stool frequency. Abnormal may be defined as greater than 3 bowel movements per day or less than 3 bowel movements per week, which is quite specific. And I can name so many individuals that fall into that, right? There's also the abnormal stool form, which is lumpy, hard, or watery, loose. Abnormal stool passages, which is you need the urgency straight away, or you are straining or feeling incomplete when you go. You're like, oh, there's a little bit more, but I can't remove it. There's some mucus maybe present, bloating or feeling of abdominal distension, straining during a bowel movement, urgency where you just have to rush and go, feeling of incomplete bowel movement, abdominal pain, changes in bowel habits, diarrhea, constipation, or both, need for bowel movement immediately on waking or after eating food, right? But you might be like, okay, I have all this, but what are the risk factors? Why do I have it? Why doesn't my neighbor have it? Well, you don't know if your neighbor has it or doesn't, right? It would be a bit weird if you know if they have it or don't. But anyway, these days, the houses are so close to each other that your bedroom might be next to someone's bathroom or your kitchen or so forth that you actually know what your neighbor does every second of the day. Anyway, let's get into the risk factors, right? The risk factors are quite interesting because, it occurs more frequently in women than men. When we think about women compared to men, we have a lot more hormones going on at different times of our cycle. We have so many things going on in our body that's cyclic, right? And our stools should be cyclic. So more women than men get it. It's most commonly diagnosed younger than 50 years of age. It's very common. IBS affects most 20% of Australians and New Zealanders. That is a lot of Australian and New Zealanders. So, 1 in 4 nearly have IBS. Stress, if you're stressed, if you have depression, anxiety, they're all risk factors. In some cases, eating specific foods like wheat, dairy, or citrus food may make it worse. In some cases, even alcohol or caffeine. Your family might have it. Another thing is also certain drugs can alter the bowel's normal motility, which I'll go into a little bit more detail. Hormones can affect it, right? Menstruation frequently triggers or makes the IBS worse, while pregnancy and menopause tends to improve symptoms. Hormone replacement therapy is associated with an increased risk of developing IBS, right? So this is a lot of risk factors there. So if you're a female that's menstruating, that may be depressed and is stressed, is Australian, is under the age of 50, you have caffeine and alcohol, and you take some drugs, you have all the risk factors to get IBS, right? So you're like, well, there's a 90% chance that I have IBS and you may have it, which is absolutely crazy. But so the thing is irritable bowel syndrome is such a frustrating condition, and no two cases ever appear to be the same. Like I said earlier, you're going to be so different to the other individual that has IBS, right? It means that due to the way the gastrointestinal tract functions rather than from pathology that is often easy to measure. So it's a functional disorder, that's what it means. And it's a common source of frustration for patients as it means there's really no effective treatment as they may believe so, right? But when you so I wanted to go back and pull it back a little bit. So when you go to the doctor and they say, how do they determine that you have IBS? So besides doing the Rome 3 criteria, they can also do an endoscopy, right? Which is a medical device which has a camera mounted on it, flexible tube. It's a tiny instrument and takes a sample of your tissue, right, in the lower GI. It's usually done through the colon, right? So you have to be under anesthetic and off they go up there. They look up, they look at the camera, see what's happening, and that's how they determine, right? There's also a thing called the barium enema, right, which is essentially it's a chalky substance is used to partially fill and open up the colon. When the colon is about half full of barium, air is inserted to cause the colon to expand. X-ray can show if there is any issues up there, right? The other one is an ultrasound. There's also, you can do blood tests to see if there's an inflammation like an ESR and so forth, right? This is what a doctor would do. Pharmaceutical treatment for it, which you may be on, include antispasmodic agents, such drugs as Donatab, Colofac, Buscopan can reduce the pain of spasm. You may be on antidiarrheal drugs such as Imodium and Lomotil before meals. You may be on laxatives if you're constipated. You may even be on antidepressants because of the strong combination of IBS and anxiety and depression and mood disorders. There is a low dosage of Trixie and SSRI depressants that have been shown to be used a lot, right? So that is kind of what, and I just spoke 15 minutes about IBS. I could even keep talking a bit more about it because it's so intriguing. So now you kind of know what IBS is, if you go to the doctors, what they're going to test for, and then essentially what treatment you might get from the doctors, right? But let's get into the most exciting part, is what triggers your IBS, right? This is the interesting part where I go into detail about, now that we know what IBS is what can trigger it? What makes it worse, right? Number one thing is stress. And the reason why is because there's the gut-brain axis. The gut-brain axis is combined together. They talk to each other all the time, right? The brain communicates with the digestive system via the parasympathetic nervous system and the enteric nervous system. They talk to each other and they say, hey, mate, down there, how you going? And the other one says, yeah, I'm all right, mate, how you going? So that's how they talk to each other, right? I don't know if it's in those exact words, but they talk to each other, right? So you've got the parasympathetic nervous system, which is responsible for digestion and relaxation. You have the sympathetic nervous system, which is responsible for the fight or flight, which is go. Most individuals, when you're stressed, you're in a go. You just want to do things and you're in a sympathetic nervous system, right? What occurs then? You're not in the parasympathetic nervous system, which is supposed to calm you and digest your food, right? So patients with IBS are commonly found to have an increase in sympathetic nervous system function and a decrease in parasympathetic functioning, which means you're not digesting and resting properly that you're supposed to be, right? Both the sympathetic and the parasympathetic nervous system control the gut via the influence on the enteric nervous system. It's sometimes called the second brain. It's an extensive nervous system in the gut that controls its function, right? This may explain what has always been suspected, that stress plays a huge effect on the gastrointestinal function. So people who have IBS, stress often leads to overstimulation of the sympathetic nervous system, which interferes with the way the food's digested, leading to pain, discomfort, and altered bowel motility, which essentially can mean, here's IBS. So if you're stressed and you have IBS, what do? You reduce your stress, right? I know it sounds simple, right? Second one is altered serotonin function. This is one a number of individuals may be put on antidepressants, but it's interesting because when we think about serotonin, we don't think that serotonin is made in our gut, where it actually is, right? Signaling about 95% of the body's serotonin is located in the digestive tract. Serotonin stimulates the enteric nervous system to initiate secretion and peristalsis, right, which is the movement of food in your body. It's kind of like it's like the movement of like waves in your body. So that's how your body moves through your body, right? So if you don't have enough serotonin, it's not going to activate that movement. It's not going to activate that movement of your food, which means food gets stuck there, which means you may essentially get SIBO, which essentially may mean you may get IBS, right? So the interesting thing is that recent research has shown that too much serotonin in the gut, so you have a lot of serotonin, can cause diarrhea, and too little can cause constipation. This is really interesting. Before your period, some people's serotonin goes up and they get diarrhea or loose stools, right? So this is so interesting. Another thing is also, the third one is visceral hypersensitivity. So patients with IBS have increased awareness of gastrointestinal function, right? So, and pain. So what this is also possibly worse for stress and psychological factors, right? So people who have IBS are actually like, oh my God, I know what's happening inside of me, you know, and it makes it kind of worse if they're stressed out, right? But so what they actually found is that visceral hypersensitivity, which is an interesting topic, they found that in studies, it's shown that reduced levels of serotonin may increase visceral hypersensitivity, which means the awareness and which means a lot more things may be going on there in gastrointestinal function, and it may be a lot more sensitive, which means IBS symptoms, right? Another interesting one is infection, right? There is a theory behind that gastrointestinal infections may increase the risk of developing IBS, and this is due to the disruption of the microbiome in our gut, the damage that it causes in our gut, and the mucosal inflammation, right? So interesting. So if you've ever had infection, such as like if you've ever had food poisoning, for example, let's say food poisoning for an example, think about if you do have IBS, think about when was the last time you had food poisoning? Is that when your IBS started or got worse? Such an interesting thing, right? Because developing post-infection IBS, including more toxigenic organisms, female gender, long duration of illness, depression, and possibly presence of a fever. So these are risk factors to make it worse, right? So a recent study in Canada found that 3.7% of participants went to develop post-infectious IBS. Other studies have found the rate of post-infectious IBS to be in the realm of 3 to 31%. So this is saying if you do have an infection in your gut, there's a higher chance of you getting IBS after it because it causes damage in your gastrointestinal. It messes with your gut microbes and it causes inflammation, right? And this leads me into the next one, which is alteration in the gut flora. Gut flora is commonly altered in irritable bowel syndrome patients. So it's interesting, if you do work with a healthcare professional, have you ever had your gut flora tested to see what is your gut flora like, right? What's happening? Do you have what do you have too much of bacteria? Which one do you have too little of? Which one's not functioning? It's such an interesting test. Stool test, I would highly recommend it. So antibiotics, non-steroid anti-inflammatory drugs, the contraceptive pill, physical and psychological stress, and a poor diet all damage your gut microbe, right? Alterations in gut flora may lead to overgrowth of potential pathogens such as Clostridium and also decrease your short-chain fatty acids and increase your susceptibility of ingesting pathogens, which equals an infection, which may then mean you might get IBS. It's like just an addition. It's like add this on equals IBS, right? The interesting thing is that almost 50% of patients with diagnosed IBS, so most people, in my opinion, most people aren't even diagnosed to have IBS. They have small intestinal bacterial overgrowth, SIBO, which I think I've done a podcast on it. If not, I'm going to do one, right? So proton pump inhibitors, antihistamines, gastrointestinal surgery, immune deficiency, malnutrition, all possible causes through much research into the factors that's needed. So they all make it worse potentially, right? So there's a recent clinical study in IBS patients with SIBO and restless leg syndrome. Over 80% had improvement after treatment for small intestinal bacterial overgrowth, which is absolutely crazy, right? It's absolutely crazy. So what this is essentially saying is there is a lot happening in your gut flora, and alterations in your gut flora can cause so many things to happen in your body, like IBS, right? The next one is food hypersensitivity intolerance. Many patients with IBS complain that ingestion of certain foods precedes their symptoms. So it's kind of like, okay, so dairy makes it so much worse. I mean, if you have IBS, you will know this, right? So the thing is, while some food intolerances are caused by the absence of enzymes needed to break them down, such as a lactose intolerance, others appear to be a defective carrier mechanism, such as fructose intolerance. Inflammation of the mucosa may also inhibit enzyme release from the brush borders. This kind of essentially saying that if you have inflammation in the mucosa, you may not be able to break down the food. You may not be able to release the enzymes to break down that food properly. So what happens is it stays there, right? And that is kind of what causes the bloating, kind of causes the constipation, the diarrhea, and so forth, right? It's kind of like the relationship between food hypersensitivity and IBS appears to be what came first, the chicken or the egg? The food sensitivity coming in the IBS, or the IBS coming in the food sensitivity? It's such an interesting thing, and this is where you need to work with healthcare professionals to understand what is happening, right? So Having a food intolerance causes inflammation and pain, damage to the gut wall, leading to inflammation and mucosal hyperpermeability and sensitivity, which I spoke about earlier. So it's kind of like, okay, so let's say you have IBS. It's kind of like, is it due to my stress, my gut-brain axis? Is it due to my altered serotonin? Is it due to my visceral hypersensitivity? Is it due to infections, previous infections, current infections? Is it due to SIBO, my alteration in the gut flora? Or is it due to food hypersensitivity, intolerance? Or there's so many others, but I've only got like literally 5 minutes to keep talking to you about this. So let's get into the tips to calm your IBS, right? Now that you know what IBS is, now that you know why it might be a habit, what are some tips to calm it, right? Number one is reduce your dietary intake of allergens, triggers, and so forth, right? So what happens is, like I said, patients may come to me and say, oh my gosh, my things are so much worse when I eat this, right? Some common examples include alcohol, coffee, excessive fatty food, sugar, the brassica vegetables, legumes, beans, onions, and white bread, right? So what needs to occur is if for example, legumes, beans, onions, and wheat appear to be the issue, you may have excessive gas production from the fermentation of the short-chain fatty acids, right? Carbohydrates. So the interesting thing is, it's kind of like do a food diary, right? Figure out what makes your symptoms worse and what makes it better. If you figure out that you had a loaf of bread, right, and the next day you're constipated, it's kind of like, that may be a link, right? Or if you've had hot chips and that makes it worse, kind of do a food diary, figure out what your triggers are. Okay, this is the key. Some of the most common ones are gluten, dairy, and so forth, right? And the ones that I've spoken about. So even if you do a gluten-free diet for 2 weeks, a lactose-free diet for 2 weeks, and so forth, and figure out, do your IBS symptoms get worse or better? If need be, you can always get a food intolerance test, an IgG test, to figure out if you've got, any antibodies to be reacting to any certain foods and so forth, right? The second one is make sure that you're eating enough protein. Why am I mentioning protein? Wow. The thing is, what usually happens with individuals who have IBS, they narrow their diet and they restrict it dramatically, excluding a lot of protein foods, right? However, difficulty, so the thing is protein is essential for many aspects of healthy digestive tract, such as adequate production of HCl, our stomach acid, right? Digestive enzymes and neurotransmitters to provide amino acids for phase 2 liver detoxification. Essentially, what this is saying is we need our protein to be able to break down our food so we don't get bloated. We need our protein to be able to make sure that we make enough stomach acid, enough enzymes to break down our food so it doesn't just stay in our stomach and we don't get constipated, right? We also need protein to make neurotransmitters, because remember the link between serotonin and IBS, right? Keep that in mind, right? Next one is a bit of a controversial one, but I'm going to put it in there, right? Probiotics. It may make it worse, it may make it better, right? So many people with IBS experience improvements with the use of probiotics. So this is the ones I want to mention about, right? So a recent meta-analysis evaluated 20 double-blind clinical trials in the use of probiotics for IBS, okay? So overall, the use of probiotics was positively associated with less abdominal pain and general improvement in symptoms. The particular probiotics are Lactobacillus casei, Lactobacillus plantarum, Lactobacillus acidophilus, Lactobacillus delbrueckii, Bifidobacteria longum. Oh my gosh, so you know what? I'm just going to put all those names in the notes, so you don't have to think about what is she saying. Essentially, probiotics have been proven to be beneficial. And so there you have it. Probiotics, protein, and elimination of any possible triggers. Easy, right? I'm going to give you a bonus one because I love you. Bonus one is chamomile, my absolutely favorite herb. I love chamomile so much. I grew up drinking it like water. Yes. So the thing is many constituents of chamomile have been found to be anti-inflammatory, including the flavonoids and so forth. In them, chamomile is also an anti-spasmodic antioxidant, and it's very useful for IBS associated with anxiety, as it sedates and appears to decrease stress, right? So the reason why I love chamomile is it's good for the head, it's good for the belly. It's good for the belly, it's good for the head. It's going to calm both. It's going to calm the brain, calm the second brain, right? Which means your IBS symptoms may reduce. Wow, I just went so much over time with this episode because I understand what it feels like to have IBS. I've been there. I have been there. I know how difficult it is, but I also know how amazing the other side is and how good it is to feel to be free from constipation or diarrhea and actually go every day, once, twice a day, and it's all good down there, right? So now that you know what IBS is, why you may have it, and what you do, please share this with someone that may have IBS symptoms that you be able to help out. When you're at a party next, mention it. Be like, hey mate, you got IBS? I know what to do. Listen to the Natural Health Podcast. Subscribe. Do what you do best. Love, like, share, subscribe, rate, share this episode, share the podcast. And until next Monday, love you.